In the morning, we would round with the residents. That would begin around 5:45. The residents would be going over a CT, MRI, or just the conditions of the patients from overnight after seeing them in the ICU. Typically on Mondays and Tuesdays, we would have clinic with Dr. Fennell, where we would go and see patients. He would also teach us and explain to us the patient's condition, and then we would go see them, watch him give very thorough clinical assessments. Sometimes when he doesn't have clinic, we would go down to the OR, or the operating room, where we would see patients undergoing surgery.
They're doing fusion of T11 to pelvis fusion, so it was a huge incision they were making. So I was able to see a lot of bones, muscles. Interventional case is also really cool. They go in from arteries or veins for wrist or groin and take some pictures of your head to have definitive diagnosis. So those are the cases I've seen in this neurosurgery preceptorship.
So we started the clinical preceptorship program last summer as a way for SUA students to get into a clinical setting, gain experience, just what it's like in the environment of a hospital. I think also there's a big difference between classroom learning and a basic biology or a basic chemistry class, all of which are the strong foundations for the kind of knowledge you need in medicine. But the gap between that and the reality of what it means to be a doctor is very different. And to be able to take in all of the Soka experience around language, around humanism, around understanding profoundly who you are and who you want to be, how you want to contribute to the world, that comes together very differently in the reality of a professional clinical setting. I see a lot of doctors, nurses who provide a compassionate care for any patients, no matter what kind of background they have. So I gained one new insight or definition about global citizenship being in a hospital setting for this summer.
In my work, I think in particular around compassion and having imaginative empathy, being able to put myself in my patient's shoes to be able to understand what's going on with them. I'm a breast cancer survivor, soon to be 2 years breast cancer free. And one of the things that was so important in going through that experience was being a patient and being able to have a whole different perspective on what my patients go through, the kinds of tests that I might order on them that maybe I had never ever had done. So I think being a person who can really dive into their humanity makes us better physicians.
It was just so amazing to see the amount of relief that they have when they're like, wow, I'm finally being understood by someone. Someone actually understands what I'm trying to say, and they feel like that they have a voice. And that goes the same for Dr. Fennell. Dr. Fennell is actually the first African-American doctor I have ever come in contact with. He really takes the time to discuss with his patients. And, I asked him on a personal level, has he faced any type of discrimination or anything like that? And he mentioned, so briefly, yeah, of course I experience it. It's something natural that you're going to experience, but you just have to continue to pursue. And I found it really inspiring.
Growing up in the Northeast, you can have certain prejudices about specific areas that you're not from, and specifically in the South. Like Daisaku Ikeda mentioned when he was here 50 years ago, that this area of the United States has a tremendous history around slavery, around subjugation, around a lot of really terrible things, but also one of the things he commented on was also that the people who have suffered the most really have the opportunity for the greatest benefit and to really make the most profound change. And so I think it's having had Daisaku Ikeda here and really the impact that he's had on people here that I can see to this day is inspiring.
When I came to SUA as an international student, that I thought that it's kind of impossible for me to pursue medicine in a different country where English is not my first language. But given this opportunity, I really think that it's not impossible. So I really want to say that if medicine is something that you're really passionate about, it's never too late to take a step into that field.
If you're thinking about pursuing medicine, I hope that you never look in the mirror and think that you were never good enough, or think that because of how you look, you aren't able to pursue medicine, whether it's because of your gender, because of your race, because of how much money that you make, because it doesn't really matter about where you come from. It's about how you're willing to put in the effort to try to care for patients. And if that's what's on your mind, then I think that the possibilities can truly be endless.
A liberal arts degree is an excellent foundation for medicine, especially the way SUA does it, with mandatory language learning, with thinking around questions related to Core 1 and Core 2, the enduring questions of humanity. Having that as a foundation of your understanding of the human experience. Global citizenship, really coping with a lot of space of not being sure and not having the right answer. That's a very different foundation for a pre-medical education than what most people get. Most people, there's like a multiple choice question with one right answer, and that's not at all what medicine is like. Medicine is teamwork, medicine is ambiguity, medicine is a complex navigation of social inequity, all the social determinants of health, all the genetic determinants of health, behavioral, all kinds of things are mixed together, and it's nebulous and it's complex, and sometimes it's very, very, very difficult. And that just doesn't come through when you're just looking for the one right answer. But to become the kind of clinicians who fundamentally change the course of medicine and of healthcare to make it more equitable, to make it more compassionate, more humanistic. That's what I hope our students gain out of this experience. I want each one of the graduates of Soka University, when they go become clinicians, that I want them to be my clinician. When I'm in my most scared state, or I need help, that I know I can call them, that I would trust them, that I want them to take care of me in the future, or my family in the future. That's the kind of person I want to raise. And that's my personal goal.